Coming up next, we'll explore the business behind medicine when I talk with Boynton Beach physician Dr. Mitchell Perelman. And in an interview taped earlier, I asked Dr. Perelman what kind of practice did he specialize in.
I practice general internal medicine. I'm located in Boynton Beach, Florida.
Yeah. Well, do you, is most of your practice involved with the elderly?
Yes, I do. I focus mainly on the geriatric senior citizen population. I've been doing that for many years, and I find it rewarding.
Well, you're in the right market. I mean, for the for the demographics, because that's basically we have a huge elderly population.
Oh, we certainly do, and it's a very busy practice, and it's really rewarding. I really enjoy it.
Well, you know, a lot of practices and groups and hospitals and stuff are going electronic. Are you involved with the electronic stuff?
Oh, yes, I am. My practice is fully paperless, as we say. I've been doing electronic records for the past 2 or 3 years. We now don't have any regular charts in our office. Everything is available on our computer system. All of the patient's laboratory data, all their diagnostic tests, everything is fully electronic. I have a computer terminal in each one of my exam rooms, and it gives me the ability to practice very, very efficient medicine.
I got you. So you really are a #1 A1 supporter of electronic record keeping.
I certainly am, and I've been so for the past few years.
Well, that's terrific. Well, you know, do you get with your elderly client base, I'll just put it this way, do you get involved with preventive medicine?
Oh, I think preventive medicine is extremely important these days. It is something that we really need to focus on with almost all patients, especially the elderly population. There's a lot of things we can do, especially colon cancer screening, mammography for females. Bone density studies is a huge thing that we do to prevent and treat osteoporosis. And there's various other things that we do in preventative care.
You know, 50, 60, 70, sometimes even in the 80s. What do you advise your patients when it comes to preventive medicine?
What I recommend is to, in females, I recommend getting a yearly mammogram, getting a bone density study every 2 years. Everybody over the age of 50 should have a colonoscopy. That's extremely important. And after that, that's usually done every 5 or 10 years, but we also recommend getting a yearly occult stool card testing just to make sure there's no hidden blood in your stool. Those are the big things that are out there. And even something as simple as a routine chest x-ray, I recommend that my patients yearly. I mean, even if they weren't a smoker, we could find anything on that x-ray, so it's real important.
Well, I'll tell you how important a routine x-ray is. I'm a lung cancer survivor, and I'm alive and walk around today because of a routine chest x-ray. They picked it up there.
I've seen that happen countless times in my practice, believe it or not. On patients that even weren't smokers. I mean, smoking is one thing, but it's something that I really stress in most of my patients.
Yeah, I think everybody should do that. Of course, I'm a walking testament to that.
Right.
That's
terrific.
Yeah.
I mean, it really is.
Well, how did you get involved in medicine?
I've been wanting to be a doctor ever since I was, a young kid. It's something that I've always wanted to do, and I just really, worked hard at it. And when I was in medical school, I really focused on internal medicine. That was something I really wanted to do because being an internist and not a specialist gives me the ability to be involved in all aspects of patient care and deal with all of their problems, not just focus, let's say, on a cardiology type of issue or just a, pulmonary problem. So it really gives me a broad range of, care.
How do you encounter the insurance industry in today's practice?
Well, the big thing that we see here in South Florida is the Medicare Advantage plans, and I'm very, very deeply involved in that. Actually, there was a recent report that almost 25% of seniors that have signed up with Medicare are now probably on an Advantage plan. By Medicare Advantage plan, I do mean Medicare HMOs. The big plan that I'm involved with is Humana Go Plus, which is actually a terrific plan. It gives me the ability to really provide excellent care for my patients. I'm a big proponent of treating patients in this fashion. I mean, we really get very involved and let the patient get very involved in their care by being involved with this plan.
Well, that's true. Well, listen, Doc, good luck to you. Thanks a lot for being here and taking care of South Florida's elderly patients. You're doing a terrific job.
My pleasure. Thanks for having me.
All righty. And stay with us. We'll return right after these words.